a very special clinical consultation network. Did anybody hear that there's something called the coronavirus? Had anybody heard about that yet?
Not so much.
Yeah, I know probably most of you have not heard of this very obscure phenomenon that's occurring right now, but we're all very concerned about it, of course. It's been all over the news. If you haven't heard about it, you must have just crawled out from under a rock. I doubt anybody in the world by this point has not heard about the coronavirus, but there's probably just a few. So, I think you don't have to look any further than, say, Italy to know that this can get pretty serious and that it really is something that we have to accept, we have to take seriously. One of the great things about this is it really does give us a chance to think about our fellow man a little bit and to think, what our responsibilities are as community members. We're not just on an island, folks. We're all together in this, and so we have to try to work together to make it happen. And I don't think that there is any group that we have to be more protective of at this point than people with intellectual and developmental disabilities, because of the number of people that have chronic health conditions within our population. It's a very, very serious thing at this point, and the only way we have to prevent or slow the spread of this disorder is to stay away from one another. Stay away. I recall that there was a curmudgeon. I can't remember who it was. Maybe it was. There have been some famous curmudgeons. I can't remember who this was, but he had his placemat said, "Stay away." What do you? So when you're walking into somebody's house, the floor mat, whatever it is, when you walk into the house, the doormat. Yeah, I can't remember that. The doormat said, "Stay away." Well, he was doing that because he just didn't want to be around people. And I guess curmudgeons are really happy right now because they get to socialize. Most of us like to interact with one another. We like to be around one another, and this is kind of a tough time, but it is something that in an odd way does bring people together because we're doing something for everybody else's benefit, and I think that's worthy of our attention. So today we're going to discuss a lot of stuff about this, and we're going to try to talk about some survival strategies. I hope that as you guys have been doing this out there, that maybe you have some things you can share with us. So when you have a comment, I hope you'll come on, you'll unmute yourself, and you'll come on and give us a little bit of your wisdom, and or just a question that you might have, or anything that might come up. And this becomes kind of an open line of communication that we have to discuss these things. Let's see. I am going to start us out with our Director of Nursing, David Taylor. He has put together some information here on COVID-19. And David, as you go through this, I might pause you periodically just to solicit some discussion from the group and to for us to be able to kind of talk about it a little bit. So I'm going to turn this over to our Director of Nursing, David Taylor. Michelle,
that's great, Dr. David. Thank you very much. Appreciate everybody attending today, and welcome. I did put together a few slides that I hope actually there's probably most of the stuff that we've already done over the last few days, or the last couple of weeks. But hopefully that will spur on some conversation and maybe some questions and discussion. But basically, just to start with,
hold on just a second. Michelle, is there something we can do about his echo?
I can put on some headphones.
I muted someone that was causing the echo, so I think it should be okay.
Okay. All right, David, I think we're good to go.
All right. Well, I mean, this was kind of humorous a little considering COVID-19 now, but we probably should have been doing this pretty excessively a few weeks ago or maybe a month ago. But pretty much the recommendations are just everything you've been hearing on the news, and stay out of public places, wash your hands frequently, avoid people that are sick, just don't travel, and stay at home as much as possible. So, the basic symptoms to watch for are fever, cough, and shortness of breath. As it turns out, it appears that a person may be able to transmit the illness prior to showing any symptoms. So that can be very significant when we talk about keeping people at home. We don't want to, it may not just be the people that show symptoms. Certainly, if you have anybody that you're caring for, or yourself, or your family, anybody that's developed any of the emergency warning signs, difficulty breathing, shortness of breath, persistent pain in the chest, confusion or inability to arouse, and blue lips or face, contact your physician and find out if we need to go. I mean, if you need to access emergency services, certainly do that, or go to the emergency room. But
hey, David,
seek medical assistance as needed.
Hey, David.
Yes, sir.
Going back to your comment about not, being contagious when you may not have any symptoms. This is such a difficult thing, I think, for people to grasp a little bit because, we think we're okay right now, but you may already have the virus without expressing it. And some people even go through the whole thing without ever having any symptoms to speak of. So in other words, they had it, they have the virus, but they never showed any symptoms. And so that's one
scary part because they're the ones that are everybody.
And a lot of our strategies are based on symptoms. But even beyond somebody having symptoms, just in general, at this point, the best prevention method we have is to distance ourselves regardless of whether we have any symptoms, as much as possible. Would you agree with that statement?
Absolutely correct.
Yeah.
And, it may be a little sacrifice for everybody at this moment. And certainly, the people we support might not entirely understand. But this is why we hope that people will try to help them, help explain it to them, and help teach them how to do some of these everyday precautions, and remind them to wash their hands often, and try to avoid touching their face, and keep the home as clean as possible, and avoiding those crowds, so that we can reduce the risk for our individuals. There's so much risk due to all the health problems that many of them have that I just really see that being a potential like the nursing home in Washington, it's just becoming rampant among everybody, and seriously, we just don't want people dying.
I personally am. I don't know if anybody else has found this to be the case. I find it almost impossible to not touch my face. I did not know I was in such love with myself that I would touch my face as frequently as I do, but I really touch my face a lot. And I don't know, is anybody else like that? Anybody else had trouble doing that? I saw a little study when I was down, before we were put on these travel restrictions. I was down in Florida a couple weeks ago, and one of the local news stations put a camera in front of a couple of people, just while they weren't paying any attention. And one of them, within about a 15-minute or maybe a 30-minute period, something like that, touched her. Might have been an hour. I guess it was an hour. one of them touched their face 42 times. The other one touched their face 72 times. So it's apparently I'm not the only one that has difficulty with it.
Well, think about all the people that you might be eating with your hands, eating burgers and fries at fast food restaurants. And it absolutely. So if you've touched anything with your hands and then you're eating the food that your hands are holding, there you go.
Well, I did sanitize prior to picking up the apple, and I cleaned the apple, so hopefully I'm okay. But it's certainly a risk every time you start to eat. And I was talking about my friend who I was teaching about washing his hands. Oh, I don't know if a lot of people got to see the video that I put out on hand washing, and he participated with me on that I was thinking one of the ways you make this fun is you want to do it for 20 seconds is you can let the person come up with creative ways to make that 20 seconds go. So in his case, he wanted to count to 10 in Japanese. He knew how to do that. And then I counted to 10 in Spanish. And then, so when we knew and we had both done that, we were pretty close to 20 seconds. And so that was, our little creative way of doing that. I was mentioning earlier that apparently the song, Thank You for Being a Friend, the theme to the Golden Girls, is another song that lasts about 20 seconds. Let's see, there's, what else was there? There was, Sing Happy Birthday Twice. That's another one I've heard. And then doing the ABC song, that's kind of part of the more common one. But, that's a way, I think if you're working with a person with disabilities or somehow trying to help them, develop good habits with all of this, it's a way you can make it kind of fun. Come up with creative ways to make that 20 seconds go by and to, do different sorts of things like that may help them enjoy developing this new habit.
Especially any song that they may like themselves. That would be appropriate.
Yeah. And if you really want to get your hands washed well, do Stairway to Heaven. You know that? Now you will come out really clean at the conclusion of that song.
Absolutely.
That's a good shower song.
Well, to cover some of the guidance that DIDD provided on the 13th, of course, Governor Lee declared a state of emergency, and they relaxed the recommendations on community participation and are offering or providing homebound services for individuals. And I have to say that we really thank Dr. Davis for working very hard to get that in place. I know he waved the flag a lot, trying to tell everybody to let's keep them home.
Well, I think we wanted to create the opportunity for people to be able to stay home and to protect themselves. That's the key. And I won't take credit for that individually. That is a lot of work on the part of our central office team and working with TenCare to get that established. And so I think it does offer agencies the ability to provide services for people and be reimbursed for those services, even if they're not able to get out into the community as frequently as they have in the past. There has not been a circumstance where we've said, that people should be absolutely restricted. However, I do think people need to be helped substantially to think about the types of things that they're doing, and they need to become very well aware of the CDC's guidance with respect to all of this. And this is part of the reason I have learned about this guidance so much is because it's been repeated over and over on the news. Everywhere you look, you're hearing, here are the things you need to be thinking about, particularly as it relates to the social distancing and the effect that has not just on you personally, but that it has on the rest of your community. So you may be a person, I've talked to a lot of people who think, well, I'm relatively healthy. You know, I think I'd probably be okay. I'm probably in the 80% of people who are going to do relatively okay with coronavirus. But, the fact of the matter is you're having an impact on everybody else around you. And David, they've talked about, because over the course of this week, it's been remarkable to look. We started saying no gatherings of over 250 or more people. And then it came down, very recently to 50 or more people. And it seems like there was almost nothing before they said, no more gatherings of 10 or more people. Well, the truth is any kind of gathering runs the risk of passing the virus. It's just that we're saying at varying points, well, at this point, we think if we're only potentially passing it to 10 people, that's acceptable. So really, what the guidance is that you really should avoid as much contact with other people as possible over the course of these days. Of course, people are in supported living homes. There are staff who work in there. So we're putting people together, and we're putting people together who have had contact with other people, and so we're running some risks. But as much as possible, we need to try to abide by these guidelines going forward. I didn't mean to interrupt you too much there, but there was just a real point I wanted to make. I think the community aspect of this is such an important thing, I think, to bring to the mind of people with disabilities. And I was reflecting on one of the most motivating things that I have ever used, I would say used, but let's just say recognized about people with disabilities, is that when something is put in the context of helping someone else, that they are often very motivated to do that thing. I don't know exactly where that comes from. I just touched my face. I just noticed that I had a little itch there, but I need to learn to resist those. But what I was saying about people with disabilities, that a lot of times they are very motivated to want to help other people. And I searched myself first and said, well, why would that be the case? Why are they so motivated to want to help someone else? And I think part of that stems from the fact that, a lot of their life, they've been basically taken care of. And that people are always talking about the help that they need to do something. And so they really relish the opportunity to turn the tables a little bit and to say, hey, now I have an opportunity to help somebody. And when I have an opportunity to do that, I really feel great about that. I want to do that. And this circumstance is perfect for that. Because we talk about, and I have worked my entire career to try to help people with disabilities be part of their community, to be able to do things that make them just a full participant in their community. And now here is the perfect opportunity for them to be able to do that and to help the community members by carrying out these different things that we've been talking about. And so this is where full participation comes into a great degree, because they're able to say, now I really am part of this community because I'm doing things to help the community members. So David, I didn't mean to interrupt you too much there. I just wanted to make that point because I think it is so important as we're moving forward and trying to work.
It's such an important message, and certainly a way to get people to participate in this as a community.
Yeah.
These couple of slides I have were just a reference from the guidance that was sent out on Friday about the community participation. I also just listed a little bit here, and I know the majority of people probably can't see this, but there was a section in that on the seating and positioning clinics and for clinical service providers. So, and then the medication administration classes. So certainly if y'all have any questions about that, this is an ideal time to bring those up. We also have just the remainder of the slides just about how the infection spreads.
Hey, David,
yes,
before
sir.
you go into that, back up on those slides where you had some of the different things that we're doing. I just want to explain a little bit of that. The call will be answered in the order in which it is. Thank you. Michelle?
I'm working on it.
Michelle, our producer.
Still have to look through 80 people to find the culprits.
I just wanted to explain a little bit about some of the decisions that were made, but the seating and positioning clinics in particular serve a very vulnerable population of people, people with severe physical difficulties and who would be very prone to the effects of the coronavirus if they were to get it. And so for that reason, we have limited their contact by not having appointments at the seating and positioning clinics through March 31st. And so, you know, that it's a decision you hate to make because they're getting important services when they come there. I think what we decided for the moment is that we should delay those, though, until we get through this coronavirus situation that we're in right now. And we also, if I could pause here for just a second, David. Now, you saw me stop myself before I touched my face that time. I was just about to scratch my upper lip, and it really does itch right now, but I'm not touching it.
Hey, Bruce, are you able to hear?
Yes, I can hear you.
Oh, good. Good, okay. You know, about this is Janet Eisner, and been hearing talk about that. One thing, you know, you can go a little easier on yourself. As long as you have cleaned your hands, you may touch your face all you want in your clean environment. That is not something that you have to stop doing. Okay.
Well, in that case, I'm just going to start touching it off. Yeah, I think the problem is not right now when I'm thinking about it right after I clean my hands. The problem I find with it is all the other times when I'm not really thinking, and then I just suddenly notice, you know, okay, yes, I've been doing this. So,
well, one way to really help remember that is any time that you're going outside of a clean environment, that to put a glove on. If you could put a glove on, then you will remember, because as soon as you try to touch your face with that glove, you're gonna know it. And it will remind you. And it's a great way to work with our individuals as well, because it gives them something concrete. And some people are doing one hand gloved and one hand not. And so if you're going to touch any surfaces outside, touch it with the gloved hand. And then that hand doesn't touch your face or anything on your body that's going to, you know, possibly get contaminated. So it makes something that's invisible a little bit more visible.
That's excellent. Thank you for coming on and telling us about those tips. And I did say this in an earlier article that I wrote, that I would love to, somebody said that they thought I could pull off the Michael Jackson look with the one glove. I think that was Paul Malanga. He chatted that while we were just talking. But you know, I think I actually had put in. Yeah, thank you, Paul. I had put into that article. I said, if you have tips about how to do this with people with IDD, like things, just something you found that was successful in getting them to engage in some of these habits, that you should send. I would love if you would send that to me, because I'd love to feature that here on the Clinical Consultation Network and pass it along to other people. So thank you so much for sharing that, Dr. Dreisner. That's very good, some very good things to get people moving. Probably, yeah.
One of
I'm sorry, go ahead.
one other thing is on the numbers of people, when you said, you've gone from 50 to 25 and 10
Right.
and so forth for the gatherings. It's really not the number of people, as you were saying. I mean, what really matters is the social distancing. And as you have more people in a room or at a gathering trying to hear each other and interact with each other, it's harder to stay that 6 feet away from people. And that's that, or to pass them, because if there's, one or two doorways or entryways, you're more likely to get, within that 3-foot distance as you're passing somebody or in a hallway. And so it's, that's the important thing is to give the guideline of the distance, and with a gloved hand, an outstretched arm is 3 feet. And so 2 outstretched arms should not reach each other. So if everybody kind of has their personal space, of the outreached arms, then that keeps the 6 feet between people. And that's a good guideline too.
If you get too many people in a small space, maintaining that 6 feet becomes quite difficult. And impossible under some circumstances if it's too many people. So, I see your point there. And I have noticed that everybody's not completely following that rule, but it's certainly the ideal scenario. Okay. So, David, were you about to make a point?
I was just going to kind of trudge forward and comment about the clinical providers, because there was a reference on that clinical providers paragraph that said it talked about the script for pre-visit health questions.
Yes.
I don't actually remember the details of what that is and who developed it or what we're following. I was wondering if Karen maybe was on and remembered that, or if you did.
Well, Michelle might have it too.
Sure.
Can we review that script real quick?
Yeah, give me just a second. I'll share it.
While she's looking that up, the comment I'll make about this is we did open up the availability of using electronic means of communication for people to carry out their appointments. I minimize other people coming into people's homes. I recognize that this is not necessarily the way we're used to doing business, so there probably are lots of questions surrounding this, but I do think that it's an adaptation we need to make under this circumstance.
Thank you very much.
So here are your questions. Michelle, did you bring those, or can you kind of review? So go ahead, Michelle.
I can review.
Okay.
So these are just questions if a face-to-face visit is necessary or urgent need presents itself for a face-to-face visit. We're recommending that you call ahead to determine if it's safe to visit, but also to determine if that location is allowing outside visitors. So this is just kind of a script we came up with, explaining to them why you're asking the questions. And then these are the questions that kind of cover, some indicators that the virus may be present in that location. So asking them then if they've taken any trips in the last 14 days to some of the locations that are on the list from the CDC, asking if anybody has signs or symptoms of the virus, asking if anyone in their home has had contact with someone who is diagnosed with the virus, asking if they live in a community where the virus is impacting them a little bit more, and there's
seems like you're going to know that piece of information.
Yeah, we've added a link in there so that you can actually check the most up-to-date version, because I know they are updating that regularly. I believe daily, but possibly more than once a day at this point. I'm not sure. and then asking if there's anybody in the home that would be at higher risk for the effects of the virus, as well as a link there for the higher risk populations.
So that's the list of questions. And of course, the question about whether you're having symptoms is an imperfect screening question. I mean, it's certainly a valid screening question, but it's an imperfect one because it's not going to catch all circumstances where a person may have the coronavirus because they may be asymptomatic. So thank you for that. And is there any, while we're paused here for just a minute, I'll just ask Michelle, are there any updates for people surrounding the billing by electronic means, billing for services provided by electronic means from the behavior and corner?
I don't really have any updates in terms of the billing. The billing is going to be the same. You're just going to be indicating on your documentation how the services were provided. And then I've sent out some emails to the BAs in terms of guidance with bypassing some of the required signatures for the time being. So if you are a BA on this call and you have not received my emails, I'm happy to add you to my list. But we will be discussing how this is impacting behavior services on the statewide BA meeting on Friday as well.
We're not speaking for the NCOs at this point. They have to speak for themselves on this. So I don't want people to think just because we said this is something that could be done that they are saying that.
I can update that I believe United Healthcare has put out a policy recently on the Cabo licensure Facebook group about their policies regarding telehealth, but we're just recommending that providers contact their insurance, and I touched my face, contacting their insurance providers to ask what their coverage is in terms of telehealth.
We have this approved, and then news we got just prior to this is that the president has requirements as it relates to providing telehealth. This is a significant move because some of the systems that people might use to provide telehealth might not be totally encrypted. And that is a requirement under HIPAA rules that however you're communicating, that it is HIPAA compliant and that it is encrypted communication. But under this circumstance, the president has suspended that. Now, do I think that means you should just flaunt it and say, well, okay, now I don't have to worry about confidentiality anymore? I don't think that's a responsible point of view on that, but it is, it should open the doorway, I think, for some people who might not have encrypted software at this time to do that. I think if you're planning to continue with this, though, at some point you should look into getting the right software and communicating in an appropriate manner with that. Okay, thanks for that. Karen, anything from the therapies corner on this?
Just a couple things. Michelle and I have been working really closely together. A lot of our requirements mirror each other. We have made some modifications to a couple of documentation requirements that would be difficult, if not impossible, in a telehealth type environment, like staff signatures and visitor logs. But for the most part, that follows. And from a clinical perspective, I think if, clinicians still need to use discretion about the appropriateness of providing the service that they have a plan of care for, whether that makes sense to do or can be done by telehealth. And, certainly they have to work within limitations that families and providers are experiencing in the home in terms of staffing. So, but, that's really something that the therapists have to. It's not just I can do everything by telehealth, but it's really a conscious clinical decision-making process of individually, does this make sense for the individual? And if so, what exactly can I do? And what format can I do it in? And then for OTs and PTs, there has to be a consideration of therapist versus therapist assistant. And as in typical situations, there's always the need to determine whether it's appropriate for a therapist assistant to provide a service to a particular individual. In this situation, if teleservices are being offered, they have to do the same thing, and they still need to work within supervision requirements of the health boards and the IDD. So I've sent out some clarifications like Michelle referred to, and we'll continue doing that as we get some additional questions. And I would just say that if anybody has questions about an urgent need and trying to work through that they should contact the regional therapy directors or myself to kind of talk through that and see what options there might be to thinking that through.
Yeah, under the Tennessee Code annotated, what we are allowing people to do now goes actually beyond what is typically allowed through telehealth, which is that you could also do a telephonic communication, any kind of electronic communication you can use to do that. However, when we exit this era, it will be under Tennessee Code annotated, and it will be required that whenever you do telehealth service, that it would be a face-to-face service. And as you said, Karen, you have to be able to do the service that you're providing via telehealth. You can't provide a service that you couldn't provide by that method.
For example, nursing services, those have to be provided.
Okay, there you go. Right.
Okay, I just wanted to add one more thing. We had a chat from Clayton indicating that Blue Care is working on preparing guidance for behavioral health providers, and it should be out soon. So hopefully they'll weigh in on
it. Okay, so that should be coming out pretty soon. All right.
Well, Karen and Michelle, thank you for adding that, because that's certainly the benefit of our discussion, is to have input from all the services. The next one I wanted to discuss was medication administration classes. They did recommend that we cancel classes at the regional offices, and they also included that independent and agency medication administration trainers should also cancel and postpone in-person classes. That has created a lot of questions for a lot of people, and we will have an official response on that to send out. Is that okay if I address that?
Yeah, I think you can go ahead and say that, David.
Basically, that recommendation to cancel or postpone classes is our position at CIDD, but it is a recommendation and not a directive for those independent and agency trainers. So if they, stick with those guidelines and the distancing of the spacing of people in those classes, and keep those down so that you can meet those guidelines, and use your judgment to go ahead with those classes as you see fit, or as the agency sees fit.
I do think
we have canceled the classes at the regional office, and we are working on an option to potentially teach a class with a webinar option, and such as WebEx, and I think we'll be able to work that out. Don't have it ready to go yet, but we'll be ready.
And that option exists. That option exists for community providers of the MedEdmin classes as well, to do them by a webinar. And also, if people are conducting the classes and meeting together, observing those recommendations regarding distancing and space that you are doing that within, are really, really important things to do as well. I understand that agencies need to get, I mean, we want to ensure that we're able to get all the staff that we can at this point because we may need them at some point. Certainly they hired them because they needed them, but maybe greater need for them as we move forward with this. So we want for people to have the opportunity to get trained to administer meds.
Dr. Davis, we had a question from a trainer about the testing procedures if we were to do say a WebEx class. We're trying to figure out the exact process for that. I don't have the answer for that right at the moment, but we'll work on it. We'll do something for the trainers as soon as we have something available.
All right, very good.
So, like I said, this was just clarification that for those independent agency trainers, it is up to your discretion. This particular slide is just talking about the way it spreads. I think we covered a lot of that. But one of the things I think we need to start looking at closely are the CDC guidelines on caring for someone that is sick with the coronavirus. And, we're getting close to running short on time, and I want to have some opportunity for people to ask questions if they want, or if there's any other issues that they would need. And so I just recommend everybody go to the CDC coronavirus or COVID-19 website and look for taking care of individuals, or if you're sick, and the things that we need to do. These are going to be important as we go forward. If it's anything like some of these other countries have experienced, and some of the nursing homes in Washington State have experienced, I'm thinking we're really going to be faced with this. And I'm not trying to be too overreactive, but it's a real potential.
Okay.
Slides where we're just, talking about the things you should be doing if you're taking care of somebody, or if you have the illness. And please just refer to those. And
David, we got a question from someone, Rhonda Rose, I think. I thought I was going to be able to unmute Rhonda, but I don't show Rhonda being connected to us to be able to speak for some reason. I don't know what what's the problem with these. She's a calling user. Well, her name is listed here, but
I know. She's a calling user. There's nothing indicated next to her name.
Okay. Rhonda, we can't figure out. Are you a calling user? You'll have to answer that by chat, I guess. But in the meantime, I'm going to go ahead. I'm going to go ahead and I'll let you continue, David. But I did get a question just now that the guidance on when to discontinue isolation is a little bit vague. So if somebody has had the virus and needs to discontinue, wants to discontinue their isolation, what the standard for that is.
The slide right now, Dr. Davis, from the CDC website.
Say again? Okay, so you've got that information here. And so the risk of secondary transducers is thought to be low. Okay. Yeah, so that is pretty vague.
I would think they would be able to get information from the doctor in terms of when it's safe to return to work.
Right. It does, they leave themselves plenty of options to say on a case-by-case basis. Most typical quarantine that I have heard thus far has been 14 days. That you would be quarantined for 14 days, symptom-free, to be taken off the quarantine. But if anybody has different information on that, please let me know. Again, that is a doctor-patient decision as well as involving the health department.
Hey, Bruce.
Generally, if they write you a note, they'll give you a return to work date within that. So I would think they would be doing that, especially with these situations.
No. Somebody else going to comment?
Yeah.
I think Victor's trying to comment.
Dr. Schuler, please jump in.
Yeah. Well, first of all, I mean, looking at the slide that was just put up, those are people that have confirmed COVID-19, and which means they've had a test to confirm it, so they have some access to the test. I'm surprised that, well, I guess I'm not surprised, but these, you know, how vague it is. I mean, with this case, if you have access to it, your doctor has the ability to test you a couple times later and get 2 negative tests within a period of time. I'm not sure exactly what that is. I think if you know somebody has COVID-19, it should be easier for their doctors to make the decision for them to go back to work. If you don't know they have it, but you assume it, or they're called what's a PUI, person under investigation, then you got to wait that 14 days. And the reason it's vague is because we really don't know much about the virus. It's why it's called a novel virus. It's new. And so I think that they're hedging their bets by making it that vague. But I certainly understand the frustration with people out in the real world trying to make staffing with vague guidelines.
Right.
One of the questions that's in the chat box is what do they do if they were tested and the test comes back negative in terms of letting them return to work?
Under that circumstance, I think go back to work if they're symptom free. You know, the symptom aspect of it is something that is generally, I don't know, I don't want to overgeneralize this, but most times you're not supposed to be working if you have symptoms anyway. But if you've had a negative test, I think you can return to work. Dr. Shearer, do you have anything to add on that?
Yeah, I would assume that also. You know, these states that are having the drive-through testing, my understanding is they're just testing them once, and sure, it'd be better if we could get 2 or 3 negative tests in a row to rule out false negatives. But I think the importance of having 2 negatives after a known positive is much greater than having 2 negatives when you just don't know.
Right.
If that makes any sense.
And that's also what I've heard. This is Janet Reisner. But there's also the guidance to after a negative test, if there was a reason to have the test in the first place because of exposure, and you haven't gone through the full 14-day period, then to continue taking the temperature twice a day to monitor for symptoms. And if that develops, then to be removed.
Well, and also if there were symptoms and you had a negative coronavirus test, it doesn't mean that you're negative to influenza or many of the other communicable diseases that we worry about every season.
So good point. And also, in what's happening, I'm seeing people with that are testing positive for flu, and that they're being they test from they're being quarantined at this point for 30 days.
30 days.
So yeah, 30 days. That's what the doc is writing.
Yeah, I think if the experts had their druthers, everybody would stay isolated entirely. I mean, I don't think there's much question that would be the preference. But under these circumstances, people are mandated to do those things. Are you going to say something else?
Could you unmute all the call-in users or everyone in case there's somebody that has a question that hasn't been able to enter one through the chat?
I can
It might be bad if we
forward.
unmuted everybody at once because there probably be some background noise. If we do that, that would make it difficult to hear.
They
What I
should
would
still be able to unmute themselves.
Yeah, anybody can unmute themselves and come on. And so, yeah, they can unmute themselves. But Rhonda emailed me her comment. She was talking about gloves, and she just wanted to make the point that if you wear gloves, that's helpful. But if you do something that invalidates the glove that you're wearing, so in other words, if you touch a surface that has the coronavirus, or if the glove gets infected or has the coronavirus on it somehow, that it's no longer really protective of you at that point. And so she just wanted to make that point. I probably didn't articulate it as fully as she did in her email, but I just wanted to make sure people had that point because we're running a little bit short on time. Are there other questions or comments that people have to make?
I wanted to go back. There was a question in the chat box that I don't believe we answered yet. They wanted to know, I'm assuming this is in reference to the med administration class. They're asking what would the testing option be for a staff attending a webinar version of that med class?
So was that a question again, Michelle?
What would the testing option be for someone attending a webinar version of the med admin class?
We're working on how to do that, and we'll send that guidance to trainers when we come up with some guidance for it. We think there's a way that it could possibly be done via the WebEx, but we just need to kind of test that.
And I don't think we would rule out people being creative about how they do that, David. Would we? I mean, they don't have to wait on our guidance if they have a...
Yeah, we would make recommendations, but we kind of like to make sure that there's integrity of the testing and the skills demonstration.
And we're soliciting feedback from people to, if we can develop that as well. So, very good. Let's see, we got this guidance information. Providers are struggling how to set up limitations on visitors. And so, as of now, we're following the HHA guidelines, the Home Health Agency guidelines, and that came out through a communication through TennCare yesterday. And it does allow the screening of visitors that come in. And so, certainly asking those questions that we talked about earlier is a part of that. Some have, I do think there is enough flexibility in the guidelines that agencies can establish their own procedures for how they're going to do this. It would be better for the time if people just didn't visit. And if we could offer alternatives to visiting, like doing FaceTime or doing Skype or something else where, you're able to have a video connection with someone, but to not have too many visitors, because that's obviously, how the virus is spread. So we just got, I keep reacting to questions as if somebody asked them out loud here. Beverly Matthews is asking about if someone is found to be positive for the coronavirus, should we report that? If a person's reported becomes infected with the coronavirus, we definitely want you to report that to us. We are in the process of establishing some new reporting guidelines. I hope that we will be able to get out perhaps by tomorrow so that we can be aware of perhaps things that would be a little bit short of having the coronavirus or knowing that the person had the coronavirus. I'd like to be able to track some of the people who are experiencing even symptoms that we're concerned about. But we're going to have to examine that and determine exactly what we want people to report. And hopefully that will come out in a communication tomorrow. Well,
Our time's up.
Yeah, our time is up. We will, I'll tell you what, it's very possible that I might schedule another one of these sessions. I certainly don't want to cut off people from being able to ask questions about these things, and I want to say our clinical services team is at your service. We want to be able to answer any questions that we can. I want to be able to help support people through this thing. I want to see us get through this successfully. I mean, it really is hard to imagine that we're going to get through it without coronavirus infections coming into play here. But I think if we can stay in communication, we can keep working together, we can get through this thing. We can do this. And I really want to encourage the direct support professionals that we have out there who are going to be, on the front line of this thing. I want to encourage people that I think we can do it if we work together and if we stick with the guidance we've been given and do things in a way that minimizes the number of coronavirus infections that we have. So thank you all for being here. This is the Clinical Consultation Network. We do this every Tuesday at 12:30, and we'll do it again next week. I imagine we'll have at least a segment next week devoted to this same thing. It's possible I may schedule another opportunity for us to do that before Tuesday. Keep an eye on your emails. Thank you for being here. We'll see you next week.
Thank you, Dr. Davis.